Okay, it's great to be here and great to see all of you here. And I will confess, I always thought that this mindfulness stuff was, for them, not for me. And then I started doing Taekwondo. What he didn't mention is that I'm a black belt in Taekwondo. So I like to do flying side kicks, so don't mess with me. And then before every Taekwondo class, we used to do about a half an hour of yoga and mindfulness just to get in the right frame of mind. And now every morning I wake up and I do about a half an hour of yoga and stretches beforehand just to set the day right. So it may feel like it's for someone else, but if you build it into your routine, I think it helps you focus every day. So I'm here. This is my second year. I'm very thrilled to be back. And I just want to say the team that did mine last year, didn't they win? Right? Yeah. Yeah. All right. So listen up. Okay, this is, as was mentioned, my challenges all around health. I'm a doctor. I trained as a cancer doctor, and I work mainly on health policy. And one of the things that wasn't said when I got introduced is that when I worked for 2 years in the White House at the start of the Obama administration. I'll tell you that in a second. And one of the things I did while I was there was to work on the First Lady, Michelle Obama's Let's Move initiative. And so I want to talk to you a little bit about health among teens in Philadelphia. It's not a great story. That's part of why I want to talk to you about it. So if you look at the various important things in health, and we can start with teen weight. And the reason I'm talking about teen health is because you are teens, but also because what happens in your early years and your teenage years lives with you. And it's hard to break out of it if you get into some bad habits. So the first thing I want to talk about is obesity. As you all know, the United States, faces an obesity epidemic. And part of the problem is we have obesity among children, and again, it lives with you. It's hard to shed that problem if you don't start early. As you can see from this little data, where's the slide? There's the slide. Philadelphia is a little above the national average in terms of teen obesity rates. The national average is not a great place to be. We would like to be under the national average. We'd like to be better than the rest of the country. We, of course, in Philadelphia now realize that we can be number one. So it's no reason to be anything but number one in the country in terms of teen obesity rate. To do that, we'd have to drive that number way down below 17, below 10%. So obesity is one element in terms of good nutrition. Second element, exercise. And as I mentioned to you, I'm a black belt in Taekwondo. I also do a lot of running. I was amazed by this data. This is probably the one that's the most disappointing to me. 25% of teens don't exercise at least once a week. We're not talking about every day. We're not talking about half the week. We're talking about once a week. 25% don't. And that in a city that has great parks, great running trails, great biking. You can use the Indiegogo, whatever. We got to do better on that. Exercise is critical to having a good heart and lung system, maintaining mental clarity. Here's another one, diet, right? Eating 5 daily servings of fruits and vegetables. Again, 1 in 10 kids do that. We're way below the national average, way below the national average, and the national average ain't so hotsy-totsy to begin with. Got to do something different about that. Now here's one. Do I keep flipping the slides? They don't come up. Here's one that's we're actually doing better, and that's on smoking. Philadelphia does better on smoking than the national average by a lot. It's still 1 in 10 teens occasionally smoke. That's been going down across the country. It's something that we really need to achieve. Here's another one where Philadelphia does a little better, although still a little worrisome. Binge drinking of alcohol. So the national average is 20%. We're down at 15%. That means 1 in 7 students binge drinking on the weekends or whenever. Binge drinking is a very bad sign, very bad health outcome, correlates with a lot of really bad behavior. And the last one I want to talk about is immunization rate. 3/4 of the Philadelphia teens are immunized. I want to ask an embarrassing question. How many of you got your flu vaccine? How many of you got your flu vaccine this year? Whoa. Well, first of all, let me tell you something interesting. It's free. Free. There's not a person here who shouldn't get it. All right? You go to CVS, walk in, free. Okay? Not only does it protect you, it protects everyone else. And if you haven't been following the news, I know that it's probably not intuitive, but people die from the flu, right? Not a smart thing not to get vaccinated. And unlike many vaccines, you have to get it every year. We can do better than this in Philadelphia. Now, as I mentioned to you, I had the great privilege of working in the White House, helping President Obama pass his health care reform and helping Michelle Obama with her Let's Move initiative to get American children healthier in the world. This is one of my proudest moments. You might be able to see me sitting to the left of someone who you recognize. I'm the guy in the blue shirt there. I had a little more hair there. I don't know what happened. This was July 2009, and we were talking about health care reform and how to pass health care reform. It was a pretty big honor to be able to work on that with the president and to actually eventually get it passed in this country. As you know, some people are trying to undo it, but fortunately it's going to largely stay in place. So that's the health scene in Philadelphia among teens. What I want to do is issue a challenge to you. The first challenge is personal to each one of you. I noticed that about half of you hadn't gotten the flu vaccine. I want you all to get the flu vaccine. So I'm challenging you personally to get the flu vaccine. That's not the big challenge. That's the easy challenge. Where's the big challenge? Where's my big challenge? All right. I made a slide of it so that I wouldn't make a mistake. All right. Listen up. Here's the big challenge. I challenge each of you to improve the health of your community by enabling people of all ages to bring 3 habits into their lives. Who changed the script? I got the old script. All right. Habit 1, good nutrition. Habit 2, regular exercise. Habit 3, emotional health. You just did the mindfulness, yoga, very good. 4, minimize substance abuse. Get rid of that. All right? Those are your challenges. As I said, last year the team that did this did pretty well. So you got a personal challenge of getting a flu vaccine for all of you and encouraging all your friends and family to do that. And the bigger challenge is to improve the health of your community with 4 healthy habits. I hope someone takes up that challenge. Go for it, and good luck. We have questions. I'm always prepared to answer questions. All right? You have a question there?
Okay. My name's Shamar, and I'm from Constitution High School.
Wait, say your name again?
Shamar.
Shamar.
The question was, do you know any like specific clubs that or like plans that we can do to help the like obesity and such? Like any ideas that you can give us in case we do your challenge?
Yeah, so that's a great question. How do we improve obesity in this country? One of the things is eating a better diet. That's the main thing. Making sure you eat well, right? Fruits and vegetables, yogurt, nuts, all very good for you, and stay away from junk food. Those are the two critical elements. We had right over here. Right over here, right?
Hey, my name is Chris, but what you call it?
Chris from where?
Parkway Northwest. So what I was gonna ask.
Hold the microphone up because we
Right,
can't hear.
I was gonna ask that. So you helped out with Michelle Obama. You know, you said the last move, right? So you know Nickelodeon when they stopped all the shows. They stopped all the shows for the 1 day of play.
Yeah, electronics.
You helped out with that, right?
Huh?
You helped out with that, right?
Yes, I helped out with it.
I was just making sure. It's my fault.
You don't believe me? Over there. Right there, right there. Yep.
Hi, I'm Walter from Northeast High School, and I'd like to ask, in what ways can we inspire the youth to be more interested in their health?
Wait.
In what ways can we make the youth more interested in their health and their own well-being?
You're asking me?
Yeah.
That's your challenge. So look, you know, here's one thing that I like to say to young people. You know, you got your body for the next 60 or 70 years, depending on how old you live, right? What you do to it now is going to be around the rest of the time. You abuse it, you're going to live with it. You treat it well, right? You eat well, you exercise, you don't put a lot of crap into it, right? It's going to serve you well. And you're going to, more importantly, one of the reasons I emphasize getting people to adopt healthy habits is because those healthy habits will stay with you forever, for the rest of your life. And I think if that's not inspiring for you, I mean, what are we but a big brain and a body, right? And you got to treat that body well if you want to be, you know, your best. Right over here. You got a microphone right over here?
Hello, my name is Emanuel Molina.
And what school?
George Washington High School. And I would like to ask you, what will you say to those people that when you invite them to do exercise and eat healthy, and they reply to you with a, we're going to diet anyway, what will you say to them?
We're going to what? Diet
anyway, yeah.
Yeah. There's no doubt they're right. You are going to die. Right? Guarantee it. But you've got, as I said to him, another 60 or 70 years in this body. It can either be great or filled with a body that's falling apart and not treating you well. And those of you, you know that when you're feeling great, when your body's working, everything's going much better for you, right? It's a much better life. So you can't still exist to get rid of that body. So the option is yours. There's no doubt you will die. The only question is when, and between now and then, how well are you living? Yeah. You, yeah. Stand up and tell us who you are and where you're from.
My name is Ruben. I go to Kensington High School. What are some things that you would suggest people doing to stay in a fit?
So let me say one thing here. The most important thing to do is to get habits in your life. That's why I started by mentioning that, every morning I wake up and the first thing I do, I roll out of bed and I do a half hour or so of yoga every day, right? It's a habit. And then I go and eat a good breakfast, right? For me, that's eggs, yogurt, and fruit, right? It's important to figure out what the right thing is and then to just make sure it's a habit, that you're doing it every day, right? And it becomes just part of your routine, and continue it. And if you encounter people who say, look, I can't go out for a run, or I can't ride that bicycle for 5 miles, you don't have to start running for 5 miles. You have to just start doing something and then build up on it. Back there, yeah.
Hi, my name
Boy,
is.
this is a good group with a lot of questions.
My name is Jeremiah. I go to Dobbins, and I was going to ask, how was it working with President Obama, and what led you down that path?
First of all, how was it? A lot of hard work. What do you think hard work is? How many hours a day? 12. Yeah. Most of the time, we worked about 14 to 15 hours every day. And by the way, we didn't get weekends off. The big joke, I know. The big joke on Sunday is just 2 more work days to the start of the week. So it was a lot of hard work. Why did I do it? Look, the most important thing for me is to try to make other people's lives as good as possible. And I work in healthcare. That's what drove me to work in healthcare and want to make people healthier. And I figured that if I could get everyone in the country insurance, we could make preventative care like flu vaccines free of charge. We would make the country healthier, and a lot of people would be better off. They would have to worry less. Their bodies would work better. Their minds would work better. And being able to work on that was one of the great things in the world. We ended up getting 22 million more people insurance. If I had a small impact on that, allowed me to affect a lot of people's lives. There's over there.
I wanted to know, you talked about obesity.
Wait, you got to hold that up so I can.
Oh, my name is Kyrie. And you talked about obesity, but I wanted to know, because since there's a lot of food deserts and a lack of availability for good food for the kids that need it, like what have you done to make that available for those kids that can't get it?
That is a great question. So there are a lot of people who live in food deserts, which means that good, healthy food is not in their neighborhood, and they end up eating prepared foods or processed foods or junk food. One of the things we did in Let's Move is to work with a lot of the companies like Wawa, like CVS, to bring healthier foods into the store, more fruits and vegetables available. I know you might be looking skeptical, but before your time, they had nothing but junk processed foods. The other thing that I think is great in Philadelphia is that we passed the soda tax, and excuse me. Soda's about the worst thing you can have, right? It's a lot of sugar and calories and zero nutrition. You need liquid, but water, last I looked, is free and doesn't have a lot of sugar. So these are the kind of things we have to do and will be helpful. There's a question here. Do we have a mic? And I can see the man's coming over with the hook. He's heard too much of me.
Hi, my name is Josephine, and I'm from Horace Furness High School. And my question is to you is that how do you feel about most people in the world not exercising and eating a lot of junk food instead of staying healthy?
I think it's bad. That's why I issued the challenge. It's simple as that. Right behind you.
Hi, my name is Heaven Thomas, and I'm from Morel Dobbins.
From where?
Morel Dobbins. So my question is today, like, health isn't actually like a community thing. This is a governmental thing. The government is actually, our so-called healthy foods are really not healthy. Like, if you ever been into a banana, it's supposed to have seeds and everything in it, but our bananas don't have any in it. And our so-called fruits is actually covered with a lot of wax. Like, you had to soak it in apple cider vinegar and stuff. And it was, I actually have a fact. This one lady, she had all these spices and stuff in her garden. So a city inspector actually came into her garden, and this lady actually knew what every plant, everything, how it helped her body and how sick she was. And they had it cut down. Like, the government, they want us to be healthy, but they're actually making us pay for all these medicines, and some people don't have insurance. Like, if you want us to be healthy, give us like our natural resources that was put on this earth to help us.
So I want to challenge you back, because I think look, I served in the government. I was a government employee for 20 years. So I think the government can do a lot of good things. And I did work in the White House, in part because I thought that there were important things the government can do. But no government can make you eat healthy, can force you to eat healthy. That's a decision you have to make. And no, you have to decide if you're going to exercise. No one can drag you. And there are a lot of good. You're going to listen? There are a lot of good foods out there that you can eat that are nutritious. And I think one thing you might want to do is teach people how to read the nutrition label and what to avoid on that nutrition label and what to eat. How to eat healthy fruits and vegetables. When you have a whole selection of things, how to select one which is healthier or not. Those aren't government programs, so we shouldn't blame everything on the government. We have to take some responsibility, and we have to get our habits and the habits of the people we love, our friends and family, healthier. Did you say I had one more question? Right over here. You've been patient.
My name is Erica, and I'm from Kensington. And I changed my question a few times, and I wanted to ask, working in the government for 20 years, if there were organizations that worked with you that try to make a difference in the community, but was there also ones that try to deceive people to doing bad things, and if those bad things damage their bodies or mental health in any way?
You want me to disparage some people and say bad things about them. So there's no doubt that there are a lot of groups and companies that are doing a lot of good things and trying to improve nutrition, make things more affordable for people. There are some structural problems, and there are groups that, unfortunately, do make money when people aren't healthy, and make money by selling things that aren't necessarily healthy for people to eat. And they also came by and tried to persuade us that some of our ideas were not right. As you heard from me, I think it's good that we're trying out the soda tax. I think we need to see if it works, if it actually encourages people to drink fewer sodas, to lose weight, to be healthier. But there are plenty of people who didn't like that idea and didn't want to have a fair try of it. So you do have this problem of lots of different groups, some of whom don't necessarily have the country's best health in mind, and that's not their top priority. All right. It's been a pleasure. I can see that there are many more questions. Maybe that means that you guys are really into your health, and this challenge will motivate you. Whatever your challenge is, go forth and make sure you're successful. Good luck, guys.